Hi, What the Health Tech listeners. I'm your host this week, Mark Fewster. This is the podcast where we tackle some of the trending topics, ideas, and best practice in health and social care. This week, we're speaking to Marcos Manhaes, Head of LFPSE and NRLS, Patient Safety at NHS Improvement, and Paul Ewers, Risk Manager at Milton Keynes University Hospitals NHS Trust. Marcos is a mathematician and health information scientist and has over 30 years of working experience in the field of informatics, with the last 16 years spent in the NHS. He's been leading operational aspects of the NRLS system since its early days. And from August 2021, when Learn from Patient Safety events went live, Marcos and his team have been supporting healthcare organisations and staff to transition to the new system. Paul has worked for the NHS for over 17 years. He began working for hospitals across Buckinghamshire before moving to Milton Keynes, UK. In 2008, it was here that his passion for risk management began. Paul led the implementation of Radar Healthcare and its integration with NHS's LFPSE system, becoming the country's first organisation to do this. Outside of work, Marcos has just finished his PhD at Imperial College London and he's getting married in a few weeks. Congratulations, Marcos. He's a competitive rower and enjoys taking part in regattas and rowing championships. And Paul's happily married with 2 children, loves music, plays piano and saxophone at his local church, and he's a massive Everton FC fan. I support Liverpool, Paul, so it's probably going to be an awkward conversation on Monday when we've won. So hi both, and welcome to What the Health Tech.
Hi. Thanks for the introduction. And
no problem. You both need slightly shorter job titles, I think, because it took me quite a while to read those out. So in terms of today, I'd like to talk about LFPSE and basically the purpose of it, what we're trying to do with LFPSE, what problem we're trying to solve, and ultimately what are going to be the overall benefits to the NHS. So I guess, Marcos, it's probably starting more with you. So what made the NHS start the LFPSE project in the first place? And ultimately, what problem are you trying to fix?
Yeah, so this is something that we always try to go back to revisit all the time. So why we're doing this and why this is necessary and why now. So we as patients, the National Patient Safety Team at NHS England and NHS Improvement, we have the remit to collect patient safety information from all providers of NHS funded care across England. And for the last almost like 20 years, so we've been doing that, relying in what is today kind of very old legacy systems. One being STIS, that's been around for about 24 years. And the other one is the NRLS, so the National Reporting and Learning System, that has been around for 19 years. So a lot has changed in terms of technology, and there are cheaper and more efficient ways of doing things today. And so one of the motivations is to make sure that we benefit from the technology that's now available to us. And some of the problems that we are trying to solve is one, around the time that it demands from NHS organizations to consolidate records, to generate XML files, and then log into a portal and then upload that to be able to share those records with NHS England. So there's a lot of time that is required from the NHS providers. So we're trying to move away from this manual process and make sure that things can happen in the background where those records are shared automatically. So this is one main thing that is going to give a lot of, or release a lot of time from staff within those organizations. Then not just the issue about in doing the uploads, but also then going back and try and reconcile the data as well. So there's a big part of this, and one so another problem that we're trying to solve is to make sure that we have a consistent taxonomy across all organizations. So everybody, kind of all organizations, all healthcare staff within those organizations are presented with same set of questions and answers. So this is to increase the validity and the utility of the data that we collect. So we're trying to improve data quality, that not just in terms of unifying the questions, but also tackling issues in terms of timeliness of reporting, but this now happening automatically through in the background. So there's a lot of data quality issues that we're trying to improve or to address within this new system.
Okay, that makes sense.
Another point is, it's just a quick point, is that we have the NRLS e-forms. They're quite old and out of date, and provides very little functionality to primary care. So we're doing a lot of work under this development of LFPSE to make sure we have a better product to serve primary care within England.
Okay, so I mean, you mentioned quite a few things there. I think a couple of things that interest me, almost that the outcomes and the data integrity, and the fact that you're getting the information faster, and in theory it's more accurate. What does that now enable you to do that you couldn't do with NRLS? So if I'm an NHS organisation and I'm supplying this information to you, ultimately what's the outcome for this? What's the real driver behind it?
Yeah, so before we had to give like a data cut, a cutoff date to organizations to make sure that everybody are able to catch up with their uploads by a certain date. And then after that will take about 3 months after that for us to release the statistics that we'll be able to create out of that data. So that will no longer be necessary. So the data should be available kind of almost real time to all organizations to access and make use of that. So we are developing new tools that will allow NHS staff to have access to that data quicker, because it's quicker, is almost real time now available to us, and we'll pass on that information to the access to staff. So we are putting together because of all this delay, it will take a long time for us to be able to create any kind of analysis, because we need to allow to have the right volume to start deriving insights and making assumptions from what the signals we are receiving. As now everything is real time, so these insights can be available much quicker and accessible to everyone.
So the L in LFPSE of learning, then how do we share that? How does that get communicated out? If you detect something, you find some insights, the information's telling you something, what's the plan for then disseminating that out to the people who were providing that information in the first place?
Yeah, so as part of LFPSE, we are also going to develop create a community hub for in a space for collaboration as well. So we will still continue using the existing mechanisms to disseminate information to the NHS, as we always did through the alerts and other systems that we have in place for that. However, now within LFPSE, it's going to be a much more kind of self-service approach, so that people can go and search for things and get more information through our platform, instead of wait to some kind of formal communication to arrive to them.
Okay, now that sounds like a great idea. So that idea of a community, then, is that something that would be open to us as kind of a local risk management system to also be able to be a mechanism to share that learning?
Yes, it's open to everyone, and even in terms of how we capturing the data now, we developed something that's about capturing examples of good care and things that can help others to improve their systems and learn. So yeah, that's open to everybody to create a community, and has to be, the vendors of risk management systems should be involved into that, because you are the guys that are going to enable um, your customers to make better use of this technology and the information that becomes available to that through that technology. So in terms of data, for example, whenever we make data available through the platform, so you'll be able to extract that data and integrate that with any BI solutions that you might have, or any kind of dashboards that you offer to your customers. So you'll be able to plug in and enhance your products and enhance the information that you make available to your customers.
Great. I can't wait to get my hands on that, to be fair. So it does sound really interesting. Probably maybe a difficult question, to be fair. What's your definition of success? So let's say, for example, we've 3 years down the line, we've got some data in the system, we've got some examples of good care, good practice that we've shared. How do you judge and understand if what you're doing is making a difference?
Yeah, so is a very key point for us, because there are the different dimensions to this. One is the how happy the user is in terms of the system. So is it easy for the user to interact with the system, and is it rewarding? Are they getting anything back of that? So is that kind of around the user satisfaction that we will be measuring that around the kind of KPIs for a digital service. So the normal thing in terms of, are you happy with the performance of the system? Are you happy with the volume of information you receive and all of that? But then there's another aspect of it, is about measuring the impact. So how is that helping you to deliver or to achieve improvements within your organization? So is trying to then measure that impact. And this is another piece of work that we will be doing with the users, and trying to see how best to capture that. And hopefully, we're going to be surprised by identifying some kind of positives or benefits that we even realized yet that it will be possible. So that's the goal. But it's about working with users, measuring the ease of use of the application, of the taxonomy, and improving those things with their feedback, and then make sure that we can link the use of the new system with actual impacts and improvement to outcomes of patients.
Yeah, I mean, ultimately, I guess that's, isn't it, the patient focus, the patient outcome. And I guess if you've got that data, you've got, I know you're not almost keen on the word benchmark, but you've almost got that start point where you would understand, here's the background run rate of incidents, for example, that a certain location's having. Once they've implemented this example of good care that might have originated in a different organization, even from that point, you can then track what impact it had. I think it's really interesting. I think understanding it's a challenge we share as well. It's how do you understand which things are making an impact? So how do you understand where to spend your time, and where you did choose to spend your time, actually did that have any meaningful impact?
Yeah. And by, for example, as I said in the beginning, that is about cutting off the system some of the manual unnecessary jobs that can be done automatically. Yep. So it's that time that we're giving back to the local risk teams that they will be able to apply in other areas and then observe the improvements that they will be able to deliver with this extra time that they're going to have. And then it's trying to monitor all of that and capture under this umbrella of impact, and then see, ideally, we will, or hopefully we'll see that translated into better outcomes to patients. And that's the whole goal.
Fantastic. Paul, I'll just bring you in if I may. You're the first trust to go live, so well done. So after just listening to Marcus there, and obviously you've as I said, just gone live with it. What does that make you think about then, in terms of how you're kind of submitting data and the benefits you might see as an organisation?
Yeah, I mean, we've already seen from day one, we've saw the reduction in administration that Marcus was talking about. So as soon as somebody submitted an incident, we know it's gone to LFPSE. We don't need to do the uploads and all the bits that we needed to do with the NRLS. So we've seen massive benefits there already. And so yeah, it's been really good.
In terms of that, the things Marcus was mentioning about learning from that data and using those learnings to then bring back into the organisation and to implement improvements, that vision then, I think I'd be interested from your perspective on that community and how you would tie into that vision, because I think that's the goal, isn't it? Obviously, we're talking about improving patient safety ultimately.
That's right. Yeah. Ultimately, that's the goal, to try and make the processes and the care that we provide safer, and make it more efficient, all those sort of things. So that goal of being able to look at things from a national perspective and learn things that are happening across the whole of NHS is really beneficial. And so getting that, like Marcus to say, getting that time back to be able to spend time on looking at those sort of things and looking at what the learning is are really sort of vital in doing that, really.
Is it a gap now? Is it something that you do, as I'm going to just say the NHS, but is it something to trust? Do you share this information now kind of outside of NRLS? Is there any sort of a community where these things are shared, or is this kind of a step towards that?
I think it's a step towards it, really. I mean, it's mainly through the NRLS that we have that community. Obviously, local organisations do sort of work together on different things, but not to the sort of the level, I don't think, to the level that we're talking about with the NRLS, well, the LFPSE form as it is now. So that community, like you say, that community, if there's a community there, so that we can have a mechanism for discussing things better, then I think that can only be a benefit.
And with you being the first trust to go live, in terms of the feedback and you communicating back into Marcus and the team, how do you feel that's gone? Do you feel like you've had the opportunity to, contribute or maybe shape the questions that they're asking?
Yeah, definitely. I mean, you can see, I mean, obviously that they want the LFPSE to be a success, clearly. And it's really important, therefore, that they speak to and listen to the people that we're using on a day-to-day basis. And they've been really, really good at that. So people can interpret questions in a slightly different way, or not quite understand what it is the question's asking, or what the response means. And so by having that kind of feedback, we've seen changes already. So we've already made sort of feedback and comments and suggestions to Marcus and the team, and we've seen some of those come through already. So there's a good sort of relationship and feedback mechanism with the team. So yeah, it's been really positive.
Great, fantastic. So back to you then, Marcus. In terms of going live, I know we spoke probably a couple of weeks ago about NHS and go live dates. Can you just clarify the timescales if you're an NHS organisation or if you're an independent provider?
Yes. So yeah, we need to be very clear about that, because the majority of the organizations reporting into the NRLS are NHS trusts. I mean, using the NRLS reporting platform. All primary care has been transferred already into LFPSE. Even I still struggle with the name. So the primary care is already using the new system, and we have a number of organizations still using the NRLS. Most of them are NHS trusts. So for those, the expectation is that by the end of March 2023, so within 12 months, almost like 11 months from now, we expect that all those organizations will complete that transition. So then we can start decommissioning the NRLS. We are already decommissioning parts of the NRLS, just to be clear about that. That decommissioning work already started.
Okay.
So the e-forms are being used by most of the independent sector and primary care. That all has been already transferred to the new platform. So that's the kind of the timelines for the NHS trusts, which are already reporting to the NRLS. In terms of independent healthcare, there's is reporting from those organizations are mostly voluntary, so we can't give them a deadline on anything or timeline, because it might not decide not to join the reporting through us, and that's absolutely fine, and it's down to them to make that decision. However, some of them, they are providing service to NHS funded patients. They might have different requirements locally agreed with their commissioners, so they need to go and play in line with already has been decided and agreed with the commissioners. So the commissioners might say that they expect them to be reporting to LFPSE next month. So that's a kind of a local agreement and relationship there. And some of them might not have that feel that they don't want to join it. So therefore, there's no kind of a timeline set to them. So it's more about their own decision. I see that most of the private organizations, independent healthcare providers, want to report. They want to join the national reporting. They want to contribute to national learning. They also want to be able to learn from the insights and data that we will be making available, and therefore there's a motivation for them to join. They can join at any time, so the system is live, and they can use the online platform, and if they have a local risk management system, they can come and talk to us and see how can we connect them as soon as they want to move.
Great. Okay. So in terms of LFPSE, then what's next? So I know we've kind of talked about things like STICE. So what's the roadmap? What comes next?
Yeah. So we working on the analytical part of the system. So the analytical tools that we're making available to providers, they are joining the system. So there are already a number of kind of analytical tools and functions that they can perform in the system, some data that they can already access, and we are working to enhance that. So as more organizations come on board, so more data becomes available, then more analysis we will switch on, and types of analysis that we'll be able to make. But we need more volume of data, so to enable those functions. So we are doing a lot of work on that aspect, as well as exploring the use of machine learning.
Okay. Yep.
To be able to generate those insights and also to monitor data quality. So you already are able to see things that when we scan for personal identifiable information, we send message real time to the user, asking them to review the text, and we really point out what text needs to be reviewed. And so this is all making use of machine learning, and we will continue to explore that to enhance this kind of a better use of data and insights that we can provide. So that is, as you said, the decommissioning of styles and bringing that function that styles provide into LFPSE. So bringing the two systems together, the two legacy systems together, NRLS and LFPSE. But this is alongside the PSERF. Mm-hmm. So you might be aware that we have a new framework for in terms of response to serious incident, and this is called like PSERF, and it's something that we are piloting now with some early adopters, and we're learning from that experience, and then we are working on a new version of the LFPSE taxonomy. That's going to be version 6. We are now live on version 5. The next one, version 6, that will include that kind of incident investigation governance aspect that is existing in styles, and now is going to be recreated under LFPSE, but not as is, but adapted to meet the new framework. So this is one of the bigger things that are coming this year.
Okay, and I believe you're going to some sort of insight on that around June time.
Yeah, we're expecting by June to be able to be sharing with vendors the kind of what change will be required.
Yeah,
but not making this live in June. So June timeline is in terms of when I'm going to come to you and say, this is the plan. Those are the new data fields, and those are the new lists. And then we start talking about timelines for implementation.
Okay, fantastic. In terms of today's session then, guys, I thought it really interesting. I'm conscious I'm going to speak to Paul a little bit more on the next episode. So I'd just like to say thanks for joining us this week, and thanks to everybody for listening. We're going to continue this conversation, as I've just said, on the 19th of May. Next week is Mental Health Awareness Week, and we're talking to mental health first aid trainer at Curve Learning, Georgina. Please don't forget to rate and subscribe whenever you get your podcasts from. And if you've got any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com. Thank you.